So I've got this Kahoot, so I was kind of hoping that we could engage people here, but as well as anybody online. So if you want to just log in, and basically I just wanted to kind of get a temperature of who I've got listening today with regards to motivational interviewing and change. So I'm going to give it, oh, we got people adding. It's like Carrie getting happy with her good slide. So I'll just give it a couple of more minutes. And while people are logging in, so I'll tell you about myself. I'm also a registered dietitian by trade. So I ended up getting into motivational interviewing. I did my first training in 2003, actually here in Portland. And it just resonated with me. I worked it into my dissertation work. I'm from Maine, so I'm happy to be home. And I worked in Maine for a couple of years, but then I worked for 7 years in Boston. And I worked at a clinical setting, and then I did outpatient counseling, where I was the eating disorder dietitian for a series of clinics down in Boston. I worked at Simmons College as a college nutritionist. I couldn't get enough of nutrition. And then I went back for my doctorate, and I did it at the University of Maine, and I worked with overweight and obese 9 to 11-year-old kids and their families. And really focusing on self-esteem, being active, but really getting away from the weight. So really encouraging more of a lifestyle change instead of zeroing in and putting the pressure of the weight on the kids. So that's really my blurb. Right now I'm working at the Rochester Institute of Technology. I'm the didactic program director now, and I teach. So that's my primary position now. So I'm going to go ahead and get started just so we can stay on time. So what I'm going to do is I'm going to hit start, and we are going to, you've got about 20 seconds, so it's just a real quick blurb. So go ahead and answer this as you see fit. We've got a pretty even split. So some people are familiar, some are, actually quite a few are not familiar, and then we've got some that are got a little bit of a taste of it, so a little bit of an understanding. So let's see the next one here. And I guess while everybody's kind of doing that, I really enjoyed Carrie's talk because I think you're going to find that a lot of things I'm going to talk about can be easily applied to what Carrie talked about, and that this really is spread across the gamut. Okay, so some people are actually trying MI, which is fantastic. So hopefully today, again, if this resonates with you, it might give you a little bit more to build on in your practice, okay? So this question is really looking at agents of change, okay? So do you feel that when you're working with your patients, when you're working with your clients, are you an effective change agent? Do you feel that you're effective with that? Okay, so most people feel really confident about their ability, which is fantastic. So again, maybe what we're going to cover today will give you a little bit more to boost that up. Okay, so last question. Okay, so you feel that way. How would your patients or your clients rate you? Would they feel that you're motivating them and really helping them move towards a behavior change? So interesting. So a lot of you feel that you're really reaching your patients, but a couple of you kind of went to the other end. So again, we'll cover information today, and hopefully it'll just trigger some thoughts and ideas and how you might be able to adjust that a little bit more. So thank you for doing that. I appreciate it. Okay. So again, thank you everybody for coming. It's a Saturday, it's early, so I just really appreciate that you're here, and everybody online, thank you for checking in. So what I'm really going to talk about today are how you might be able to incorporate motivational interviewing and aspects of behavior change. What can we do as providers, as dietitians? So just to get a feel again, how many are going into nutrition or looking at nutrition? A few? Okay. This can be used across the board. It can be used in sport, it can be used in dentistry, it can be used in healthcare. So really I'm just going to introduce to you some basic concepts of motivational interviewing. What does that look like? An overview, hopefully if this feels good, it'll generate a little bit more of an interest for you. We're going to discuss the role of ambivalence. So, listening to Carrie talk about, some of the athletes, if they are struggling with disordered eating or an eating disorder, how do you help somebody work through that ambivalence, right? They want to perform extremely well, but there's some things that are holding them back with regards to eating. So how do you work through that? We'll identify change talk. We'll talk about change talk a little bit. And then my thinking is, could I give you something tangible that you might be able to walk out of here with and incorporate in your sessions? And this is called the elicit, provide, elicit technique. Okay, so we'll kind of tie that in at the end. Does that sound like a good plan for the day? Okay. So what's motivation? I think it's really important to remember the fact that this is not a character flaw. Okay? It's something that someone does. It is not a detriment to them as a person. So how do you help people kind of work through, right? And the process is you recognize there's an issue, you're searching for a way to address that issue and come up with a plan, okay? But it's really important. As clinicians, we can always blame our client, right? They're not ready for change. They're not motivated, they're resistant. But again, Carrie set the stage perfectly for this because it goes back to what do they want, right? What is it that they want? Where are they? But even if you want to bump it up a notch, where do they want to go, right? We're talking about athletes. They probably want to be performing at their peak level. How do you work through any ambivalence that they're having to get them to that point? Does that make sense and feel kind of what you're working towards with your patients? This is fluctuating, okay? I'm sure everybody, me included, you might get really motivated to start something, right? Really motivated. It might be your New Year's resolution, more exercise, eating better, and then it just kind of dwindles off, right? Our patients are the same way. They're gonna have ebb and flow of motivation throughout their process. It's not a straight shot. The beauty of this is that, again, if you have the skills as a provider, whatever realm that is, we can actually have an influence on this and eventually help people move them towards behavior change, ideally, which is what we want. We want positive patient outcomes across the board, whether that's improving their A1C if they have diabetes, whether they're an athlete, you're improving that, whether you want people to start brushing and flossing their teeth more. But we can have an influence on that. And so this is where motivational interviewing can really come into play if you're interested in applying it. Okay. So what is motivational interviewing? This is the textbook definition. And so it's a client interactive, client-centered approach to helping people work through their ambivalence and get to behavior change. Some of you might remember there's two types of motivation, right? There's the intrinsic motivation, and where does that come from? Anybody know? Inside, right? I heard some people saying inside. So this is the motivation that comes from within you, okay? Then we have external factors, right? Extrinsic motivation, so something that might be triggering that to cause some change. The thing I love about MI is that it's not confrontational, okay? This was developed back in the early 80s in the area of substance abuse. And before, the counseling style was very confrontational with regards to addressing substance abuse. MI is a very soft approach. It's not harsh, it's not directive, it's a very soft eliciting approach, really helping people work through their struggles with regards to nutrition, dental health, athletics, whatever it might be. So again, if you're using the skills right, you're helping people find their own reasons for change and getting to that commitment. If people come up with their own reasons for change, they're more likely to stick with it. And this is what we want. Again, it's all about behavior change. What is that outcome that we're looking for? Okay, so as a provider, so just to kind of give you a general kind of overview as to what this is looking like. So what you're gonna wanna do as a provider is explore discrepancy, okay? So what you're gonna probably find are your patients, okay, your clients, they're split. They're ambivalent about some sort of change. it's very important that we not impart what we want our clients to do. We've got to figure out what it is they want. Where is it that they want to be going? Another part of motivational interviewing is figuring out how to elicit change talk. Motivational interviewing, it takes time to get to where you want to go, but you don't have to be proficient in it to start seeing the positive benefits of it. So it doesn't have to feel like you're climbing Mount Everest to be able to start incorporating MI. You can start very slowly and you'll see a difference and a change in what is going to be happening in your sessions. So identifying and listening for that change talk. So we'll talk about that a little bit later on. Another thing to remember is MI is not about talking people into it. Okay, you're not trying to persuade them or convince them. Researchers have actually found that the least effective approach to interventions and counseling are those that focus on fear, guilt, and regret. Okay, so motivational interviewing, we are not working on the negative aspects of where a client is at. We're zeroing in on the positive pieces. So that's really important. MI is not a manipulative approach, which I get some kind of talk about that you're trying to trick people into changing. That's not what it is at all. It's really figuring out, do people want to change? If yes, how can you help them work through that for them to identify what they would like to do? Okay. The patients must be involved in the goal setting. This is, again, going back to what I said, you don't want to be directing and telling people what to do. It's not MI. Motivational interviewing is really helping the clients come up with their own reasons for change. What do they want to do? Okay, so that's really key, is to make sure that they're incorporated. Okay, so again, Carrie talked about evidence-based. So as a dietitian, that's what we want. We want whatever recommendations you have to be evidence-based. So I zeroed in on this one meta-analysis, and it's looking at behavior change. I can't remember how many studies, but it was hundreds of studies. And what I want you to see here is the effect that motivational interviewing had on these measures. Okay, statistically significant change in body mass index, statistically significant change in blood cholesterol, okay, in blood pressure. And in the healthcare field, these are all measures you want to see an improvement in. These are what we would consider very positive patient outcomes. And so the effect of motivational interviewing, looking at these studies, tallying them up and doing the statistical magic that they do, this is what they found. So this is very promising. MI is evidence-based, and I think a lot of people don't recognize that. There have been over 1,200 studies done in motivational interviewing, and 200 of them have been randomized control trials, which are the kind of studies that we want to see. Just some other kind of really catchy stats that came out of this meta-analysis. The traditional advice giving, right, which is usually found in the standard care right now, it outperformed in over 75% of the studies. So this is a pretty big number, right? We want to start seeing behavior change, and we want to see how you interact. How are we giving information? 75% of the studies demonstrated that MI was actually more powerful than the traditional advice giving, okay? Effectiveness was shown in even brief encounters of 15 minutes. So again, I hear it a lot, especially from physicians. I don't have time to practice MI. I have 15 minutes to see my patient, right? Think of when you go to the doctor. It's a pretty rapid turnover. There's not really a lot of lull. In 15 minutes, you can have an effective MI session that's going to have positive results and positive interaction with your patients, okay? And this is also important. What this is saying is you don't have to be a counselor in order for this to work. This is across backgrounds. So they looked at doctors, nurses, dietitians, who else was in there? Psychologists, social workers. So what they found is you don't have to be a counselor for this to work. You can, as long as you've been trained in it and you're practicing it, it's effective. Okay? So this, again, is really exciting because it works. So we're talking about change. Okay? This is what we want it to look like, right? Like going back to what Carrie said, here's your meal plan, eat it, and you're gonna be the best hockey player you possibly can be, right? It's not like this, okay? Change is across the board. Success looks like this. It's in disarray, right? It is not a straight shot. I've mentioned ambivalence, okay, which is where, do I change, do I not change? That, what do I do kind of, it's called stuckness, they're stuck. This is ambivalence. All these twists and turns. So when you have a client coming in to talk to you, and you're able to sit down with them, listen to them, right? What is it that you would like to do? I wonder what you're going to do with that. I wonder what decision you're going to make from that. You're putting it right back on them, but you're helping them work through this turmoil. And I think we've all been in that place where we just don't know what to do, right? We've got the graduate program here. How many people, do I go back from a master's, do I not? What do I do? So it's a journey. And this is where MI can really step in and help your clients work through that stuckness, okay? Why do people change? There's a lot of reasons for why people change. They think it will be worth it, right? The pros outweigh the cons. A couple of things I want to zero in here is they actually have the confidence to do it. They think they can do it. One of the things I used to say to my patients all the time is, I believe if this is something that you want to do, you'll do it. Because their self-efficacy, their confidence in their ability to make a change is usually way down here, because they've been blasted and blasted and blasted with information. It's there. And a lot of them, they might have succeeded for a period of time, and then they kind of dwindle back. So confidence is key. So people change when they think they can do it, if they have a plan, okay? So you're gonna help them work through that ambivalence, get them to elicit what their own ideas are, and get a plan in place that they're responsible for, right? They're gonna help set those goals, okay? Support is also very important, okay? When I worked with my kids for my dissertation, having the parents involved was key. It was key because you need to have that support system. It's very hard to make a change on your own. Would you agree with that? It's always nicer to have somebody that's got your back and is building you up a little bit. You can be that for your client. You have the ability to be that for your client, okay? They think change will be worth it. So all of these things, you're going to be listening for change talk that comes out of these things here, okay? And we'll talk a little bit more about that. Okay, so ambivalence, right? Yeah, yes or no. What you're going to hear are two different types of talk, okay? One is called sustained talk. And those are arguments you'll hear your patients talk about with regards to staying at the status quo, okay? Things are okay. There's not really an urgency. Things are working okay. Maybe their blood sugar's up a little bit too much, but overall it's all right, okay? So you're gonna hear sustained talk. You're also gonna be zeroing in on change talk. And those are the arguments that your clients are gonna give you. They may not even realize they're doing it for change, okay? There's a need, there's a reason, they have confidence, they feel that they can do it. So you actually might hear these in the same sentence. You actually might hear change talk and sustained talk in the exact same sentence. And this is where, again, using motivational interviewing and being able to identify the difference between the two will be very helpful in moving you in that direction, okay? This is not a negative place to be, okay? If someone's ambivalent, that means there's change talk in there. They may not necessarily be making that change, but there's reasons in there for the change. So in honing in your skills with regards to MI and zeroing in and learning what you're listening for, you're actually hitting a gold mine because it's there. So how are you going to help draw that out, okay? And going back again, we have the opportunity as a counselor, as a therapist, as a physician, as a personal trainer, to help people work through that and get to that point, which is very exciting with regards to MI, okay? Another thing that I'd like to offer you to just kind of think about. I'll take a poll here. If you are told to do something, if you've got something pressing, maybe you've been to the doctor or the dentist, and they're telling you what to do, what's your automatic reaction? Question, right? Does anybody get a push back just a smidge, right? Maybe say, you know, I know what I need to do. I don't need you to tell me again, right? Maybe pushing back just a little bit. In the trainings I've done with dietitians, I refer to us as being the helpful dietitian, okay? Most dietitians I know, we are gung-ho, and we want to help people eat better. We want them to feel better. We're very excited to share our knowledge with our patients. But if you start giving the arguments for change, right, which is what we're going to want to do, if we start giving the arguments for change, what's going to happen is the client's actually going to start giving you reasons for staying at the status quo. Okay? They're not going to necessarily say, you know what, you're absolutely right. They're actually going to start giving you reasons for why they stay the same. I see a couple of people nodding. So it's something that you really want to be careful of. You might hear this as yes, but. Okay? You know, great idea, yes, but, you know, I'm just too busy to pack my lunch. I really just don't have time for that. So being aware of what arguments are you putting out there and where are you siding? Because if you go for the wrong direction, it's going to move you in the opposite direction. You want to move people towards change, not kind of sitting and stewing in the status quo. Does that make sense? Okay. So why don't people change? Are we good?
No, I'm just smiling ear to ear because I want to share that when I talk with my patients and we're talking about their trigger foods and problem foods, and if I say, okay, no more Cheetos in the house, then that's the first thing they want to go and get. If I say, no, don't do that.
Yep.
So you're so right.
Yeah. So it is. I mean, if you start putting stipulations on people with what they can't do, it's not going to go over as well. And again, it's going back to, we want to help build people up and move them towards their behavior change. We don't want to build walls. And that's, you know, we'll talk about that. It's called discord. So if you're starting to feel people maybe interrupting you, arguing with you a little bit, a lot of yes buts, chances are there's something in that relationship that's having an impact. So we have to self-reflect and look at ourselves. Am I not conveying this appropriately? Am I triggering that discord, right? Not that smooth partnership that we're going to talk about in a minute, but really struggling with that, okay? So again, this kind of says the same thing, right? You need to get your A1C down. You need to cut down on your portions of carbohydrates. You need to walk 30 minutes every day, right? When we bombard, people sometimes check out, okay? So what do we want to do? We want to help them work through that stuckness. We want to avoid this and create a safe environment for people to be able to be honest, express their concerns, express their fears, and hopefully start coming up with some good goals. Keys to readiness. So we're talking about behavior change. We're talking about helping our clients get to that point. You need two things for readiness to happen. Okay? There has to be a level of importance there. So there has to be, for the client, not us, right? Because we already see the importance there. The clients have to see an importance for making this change. Why should I do it? What's in it for me? So going back to those reasons for change, what is it, okay? And confidence is key. And again, this is another area, as a provider, that you're able to help them work through and build their confidence up. Because I guarantee you, most of your patients' confidence is going to be here. They've struggled, they've worked, they're getting bombarded, they're getting nailed. How can you help build them up, okay? Once you've got those, readiness is going to kick in. Okay, so helping them work through that. Okay, we can influence this. This is where we have an ability to help. Okay, so this is a new visual, kind of like what Carrie's happy little slide. I think this really sums it up very well. All right, so the standard of care, as I've mentioned, it's very much a directive, advice-giving approach. We tend to treat people as if they are empty vessels, okay? We need to pour all of our knowledge into them. We need to fill them up. We need to be our helpful selves and help them with their behavior change and give them all the ideas that we possibly could to be able to help them with that change, okay? So it's directive, and we're treating them like we need to fill them up. What MI is going to be doing is making the assumption, which is a very fair assumption, because if any of you have thought about making a change, you probably already know why you should do it. Would that be a fair gauge? You have enough knowledge, enough information to know why you should make that change. What MI does is bases it on the fact that the ideas, the reasons, the desires are already within our patient. What we need to do is siphon them out. Okay, put them all in a bucket and be able to present it back to them. Okay, so we're listening, we're going to talk about listening, we're going to talk about empathy, we're going to talk about compassion. This is what we need to do. We need to treat our patients as full vessels. It's there. How do we siphon that out and get them and help them get to where they want to be, right? Not where we want to be. Okay. There's a term that you'll read about with regards to motivational interviewing called the Righting Reflex. Okay, this is where the helpful dietitian really comes into play. We are all in the helping profession. This is something that we want to do. We want to help people. We want to see people feeling better. We want to see them controlling their diabetes. We want to fix things, right? We're in this field because this is what we want to do. We might need to set them right. Right? They just don't know. We need to correct them and put them on our path, right? We have all this education. We're the experts. We know what to do. The reality is we're the expert in our field. Our patients are the experts on their life and themselves. So going back to that picture with the glass, right? It's already in them. How do we draw that out? Okay, setting something right. Getting someone to face up to reality, right? Working with patients with eating disorders. If you don't eat, you're gonna have to go inpatient. Okay, your electrolytes are too low, your weight is dropping too much, you have to go inpatient. Okay, this is not going to help. They know that. They know that. It's a struggle. They're ambivalent about it. Okay, so what you're wanting to do here is guide. We have to fight the righting reflex. We've really got to try to correct that. If you are able to practice this in your sessions and not jumping at trying to fix things, watch what happens to your interactions with your patients. I've been doing some trainings with advisors, actually, at RIT where I'm working, so college advisors. And they have to meet with their advisors. It's required. So it's basically mandatory counseling. And so I did a brief interaction, a brief training with them, and just talked about some things that people could work in if they were interested. I got an email that afternoon. So I talked in the morning. I got an email that afternoon from an advisor. All she did was, she was sitting with one of her students. All she said was, "That must be really frustrating for you." Walked through, he says, "Yeah, yes, that is exactly it." She guessed exactly how he was feeling. And then she said, "I wonder what you're going to do with that. I wonder what you think would work for you to kind of work through this." He was having trouble studying. And he actually came up with ideas. He got up and left and said, "This was the best session I ever had." Okay? She had not heard about MI before. It was a 2-hour talk. But just adding in a couple of things had a positive impact on their session. So again, it's not Mount Everest. If this feels right for you, you're able to find some things to start working in. But guiding, not directing, okay? helping people elicit their own ideas for change, not giving advice, okay? So some of the things that actually might trigger some discord, right? Maybe some tension in that relationship in the room. These are Thomas Gordon's 12 roadblocks to listening, okay? I just highlighted some of the things that I've seen and that might come up in the healthcare setting. But again, directing, warning, right? If you don't get your hemoglobin A1C down and get your blood sugars under control, you're looking at serious health complications, right? When you're diagnosed with diabetes, that's the first thing that you hear. And scare tactics are not going to help. It's going to cause people to shut down. Scaring people into change doesn't work, okay? Giving advice, making suggestions. You absolutely can make suggestions, but what you want to do first is actually ask permission. Would it be okay if I gave you some ideas? Now, I've had some smart aleck patients that say, well, yeah, that's why I'm here. Yes, tell me. But other patients, and the majority of the patients, are like, yeah, that would be really great. They didn't expect me to respect the fact that maybe they didn't necessarily want to hear what I had to say. So working in that asking permission first, persuading with logic, right? Again, they have the information. Their glass is full. Find out what they know and how you can build on that, okay? I put these at the bottom here because I think these are 3 of the biggest things to be aware of. Making judgments. This can happen very inadvertently. It just might happen. When I'm talking to my students, I tell them, you're gonna have your dietitian brain and you're gonna have your human brain. And sometimes your patients are gonna tell you something that makes your dietitian brain want to explode, right? With regards to foods that they're eating or eating habits, you have to respond with the human brain, right? And time it with regards to how are you going to share that information back. So not judging, not criticizing, not blaming. The other big thing is shaming. One of the kids that did my dissertation project with me, so he was 11. So the year before, the summer before, he had seen his pediatrician. And he said, well, I saw my pediatrician last year. Okay, this is a 10-year-old kid. When I saw him last year, he told me I was getting a little chunky. Chunky is another word for what? Fat, right? His mother got tears in her eyes and said, he never took his shirt off swimming after that for a whole year. The pediatrician didn't mean to do anything negative. He was trying to find a nicer word. But what he did was end up shaming that little kid. And he remembered it a year later. So it's just being aware of the words that you're using and making sure that you're not imposing what your thoughts are, your agenda, on where your clients are. Because words matter. They really do matter. Okay. So I like this picture. I love elephants. So this is what's going to happen, right? So you have the righting reflex. You're jumping. Again, this is coming from a very good place. We're here because we want to help. So righting reflex, okay? And you've got ambivalence. Your patients, and this is what you're going to end up doing. You're going to be fighting and you're going to be struggling. And I'm not necessarily saying a yelling match with your patient, but it's going to feel very tense and very much a struggle to be able to get that information out and help your patients work through their ambivalence, right? Their stuckness. So if you start pushing, you're going to get that back. So it's really focusing on dropping that righting reflex. And again, if MI feels like something that you want to work in, this is something to be aware of and be thinking about how you can do that. And remembering to appreciate ambivalence is normal. This is absolutely normal, and there's change talk in there. So you're not losing out. There's change talk. Okay? So I'm keeping this term up there because if you read about motivational interviewing, you're still going to be reading about resistance. But we're really moving away from that word because ultimately it's a judgment call, right? If you say someone's resistant, you're making a call based on where you expect them to be. Would you agree with that? Okay. So we've talked about sustained talk, which is arguments for the status quo, Discord is going to be a sign of something not right in your relationship. Like I said, there might be kind of a little bit of arguing, there might be yes, but they might be interrupting you. You know, you might be on one of your, information giving spiels. Again, helpful, wanting to help, and have an interruption. The patient saying, no, but I can't do that. That's just not going to work for me. So if you've got those things kind of going on in your session, you want to take a step back and see, what am I doing to contribute to this? Because it's coming from you. Discord is a sign. So let me kind of click through. Sustained talk is going to be about the target behavior. So if you're, working with a young kid, again, I really don't want to stop drinking with my friends. Okay, it's about the behavior. But the discord is going to be specifically about your relationship. And it's going to be you, okay? You don't understand how hard that would be for me. You don't get it. You could never understand. And you might hear that if you're in with an intense session with a patient. So if you start hearing you don't, you can't, you'll never understand, take a step back and see, can you adjust that? And you absolutely can say, you know what? I would like to just step back a little bit. I realize I didn't give you an opportunity to share your thoughts with me. Could you tell me more about that a little bit? So you recalibrate, kind of reset the session, and offer it back to them to restart it, okay? Use a lot of we language, we are a team, we're working together on this. Partnership is a key part of the spirit, which is right here. Researchers have found that incorporating components of the spirit, so if you've got the spirit in your sessions, there's positive outcomes from that. So you don't have to be fully proficient with all the skills and the processes of MI and getting the principles in. The spirit is powerful all in itself, all right? So partnership. One of the analogies that we use with motivational interviewing is that you want to waltz with your patients. You don't want to wrestle, okay? You want to have them take the lead and you're going along with them. Acceptance is really supporting and identifying and honoring your client's autonomy and self-worth. You're accepting them for the decisions that they are making because they're their decisions. It's again, kind of stepping back and not imparting what you believe you should be putting on your patients. Evocation is, again, getting at the why, okay? The whys of the behavior, and triggering out that change talk. And then compassion. So Carrie talked about compassion. This is key, okay? We're going to talk about empathy next. But having compassion and caring about your patients. Think of different scenarios that you might have been in with a provider, and think about the experiences you had where it was a very positive experience. You probably felt heard and understood and supported, versus those sessions where you might have been given a handout and saying, come back and see me in 3 months and let me know how you're doing. And all of these different components are what the spirit is. It's all kind of wrapped up together. So going back to that slide, our clients are competent. They can do this. Giving them a safe environment, honing in on skills, perceptions, adjusting your approach can help with that. We have to assume that the knowledge is there. And again, we want to be present. We want to be sitting there. We want to be listening. We're giving our all to our patients when they come in and sit with us. Okay? So that's the spirit. Empathy. So we were talking earlier about dogs. We're dog people. Dietitians tend to be dog people. Empathy is, let me start this. It's the #1 predictor of treatment adherence. So if you are able to express accurate empathy to your patients in your setting, that is the #1 predictor of treatment adherence. Most people are only about 50 to 70% adherent to taking the medications that are prescribed to them, just to kind of give you an idea. So if you're able to bring out and demonstrate accurate empathy, which, does anybody know what empathy is? What the kind of general concept of empathy would be? Anybody? Your ability to relate, thank you. So it's really your ability to be able to put yourself in your client's shoes, okay? So really being able to sit with them, and it's, I feel your pain, right? Sympathy would be more like, I'm sorry you're in pain. I'm sorry about that. Empathy is saying, I feel your pain. It's truly putting yourself in their shoes to see where they're at. Empathy is one of the principles of MI, which, again, if you come to the breakout session, we'll talk a little bit more about that. But this is just very, very important. There was some research done out of the University of Virginia, and we are actually, what they're finding and what they believe is that human beings are actually hardwired to be empathetic beings. We're actually hardwired for that. So they did a study where, I think there were 25 people, and they brought in a friend or an opposite gender friend of theirs. And what they did is they actually did MRI studies of the brain. They connected, to measure that, they connected little shock buttons to the ankles of everybody. What they found is when they knew that their friend was going to get zapped, the part of the brain that produces empathy, that feels empathy, lit up greater than the fact of a stranger that was getting zapped. So when they could feel and know that the important person that they brought to them was going to get nailed with an electric shock, their brains lit up. So again, once you build the relationship with your clients and you have this relationship and they feel that you care, it's going to have really powerful outcomes on that. Okay. Again, I really like this visual because when we're sitting in that chair at the other side, we have to, it's got to be like looking in a mirror, right? Would this help? So taking a look and taking a step back, how do you do that? Empathy, just being able to acknowledge, you seem very frustrated. You must be exhausted. That would be a statement I would use with my patients with eating disorders. This is a 24/7, 365-day-a-year voice in your head constantly telling you you're not good enough. So being able to recognize you must be exhausted from that, and to see the relief that comes across our face and say, yeah, it's exhausting. I don't know how I can do it. So being able to just put yourself in their shoes, very, very, very important in building that positive client relationship. This is one of my favorite slides with regards to MI. It's the Chinese character for listen. And so you can see that there's 5 different characters needed to create this one character. So basically, with MI, you're using all your senses, okay? You're using your eyes. You're watching to see what you say, how it lands on your patient. You're focusing. You're listening. You're using your heart to feel. I think this is why I love MI so much, is that it really brings that heart into it. And if you like those relationships with your patients, this is going to work. You're going to be thinking, you're going to be processing and looking and trying to piece together, how can you help, okay? But you need all of these senses to be able to really be fully present with your patient. So listening for change talk. So I've talked about change talk. And there's different types. Again, this is only a little tiny piece of motivational interviewing. I could talk about this all day. So to get it into an hour has been very hard. So what you're going to be listening to with regards to change talk are the different pieces of it, okay? So there might be a desire for change, and what that might be is a statement for a preference for change. So you might hear somebody say, I wish I could run a 5K. Okay, there's a desire there. There's something that they'd like to do. I wish I could get my cholesterol down. I wish I could do that. That's a piece of a desire. Ability is going to be, again, going back to their capability, their ability. Do they have confidence? Do they have self-efficacy that they can make this change? Okay, I think I could. Right? You might hear a statement like that. I think I could maybe walk in the morning for once or twice a week. I think I could do that. A reason is going to be a specific argument, okay? I want to be around to see my grandchildren grow up. I want to be able to kick a soccer ball around with my kids and not get out of breath. Okay, there's a specific reason that they're wanting to make that change. The difference from reason to need is, the way I describe it is, there's an urgency. There's an urgency to making that change. If I don't get my blood pressure down, I'm at a risk for a stroke. And I don't want to have a stroke like my grandfather did. There's a specific obligation and an urgency to making the change. And then this last piece, and again, you might see a couple of other things. The next slide, I've given you some more to kind of tie that in. But what are they willing to do? What do they want to do? I guess is a better way to say it. What actions are they going to take to start working towards this behavior change? MI is full of acronyms, so you'll see this written as darn C or darn cat, and I'll give you the A and the T on the next slide. But these are the phrases you're going to want to be keying into. I am, I can, I will. That's probably the best one, because that's a pretty straightforward statement. I will do this, okay? I can. That's another really important one. They're feeling that they can. And the more you can evoke change talk, the more you're likely to get change. You're more likely to get that behavior change because it predicts it. So if you're listening to it, you want to zero in. And this is where, if you're interested, going to a 2 or 3 day training on motivational interviewing would really be able to help you kind of hone in on this. Okay? So a little motivational interviewing mountain. Okay, is anyone familiar with the stages of change? Is that, okay, a couple. So what I want to zero in on here is there's going to be 2 things that you're going to want to be doing with change talk, okay? Once you learn to identify it, right? So the darn right here, desirability, reason, or need. This is what we call preparatory change talk. We're getting people ready to go. And they're thinking about it, right? But they're not 100% there. They're ambivalent, okay? Then what we're going to do here is we're hoping on the commitment, right? So we've made it over that hill. We're getting commitment. We're getting specific action plans, and we're taking steps towards that behavior change. Does that make sense? So you're listening, you're hearing, you're being able to kind of zero in on their ability, their reason, desire, need. You're talking, you're honing, you're evoking that. And then what you're doing is you're getting to the other side. And what do they want to do? Keeping them involved in the goal setting. They have to be involved. It can't be your goals. It's just not going to be as effective. Okay? So this is one of the skills I talked about at the very beginning. If you wanted to walk out of here with something to try, it's called the elicit, provide, elicit approach. And you'll see it written as EPE. Okay? So what you'll do is you'll be sitting in a session, okay? And what you're going to want to do is thinking back again to that glass, okay? Making the assumption that our patients are competent and they have the knowledge and the self-awareness of the changes that they should make, okay? So what you're going to want to do is elicit what they already know, okay? So, tell me what you know about treatment plans for smoking cessation. If you're talking, if any physicians in the room, tell me what you're looking at with regards to, tell me about what you know about programs to help you with smoking cessation. Okay, so what you're doing is you're eliciting what they know. Okay, what knowledge do they already have in their well? The next thing you want to do is, again, ask permission. Okay, so you got that. Would it be okay if I shared with you some other programs that have helped some of my other patients? Would that be okay with you? Generalizing it. Okay, and making it so it's not specific, but in general, things that might have worked for other people. Okay, like I said, usually you're going to get patients to say, yeah, that would be okay, because you're not saying, well, here, have you thought about these? Why don't you think about these? Right? Do you see the difference in how that information is presented? So you ask permission. You're going to offer this information, okay? Slowly, you're going to support their autonomy of choice because they're going to make the decision that they want to do, no matter what, okay? You present it to them, and then you're going to want to elicit back what they got out of that, okay? So, tell me what you know about smoking cessation programs. They tell you what they know, okay? Obviously, they're still struggling, right? Because they're sitting there with you. Would it be okay if I offered you some other ideas? Okay? So tell me what you think of that. Tell me what your thoughts are with that information. You know, how do you think that might work for you, if at all? Okay? So making sure, because we've all had that experience where we give information, but it's that communication circle, right? What you say, what they hear, what comes back. Remember that telephone game we used to play when we were kids, right? Whispering. So this is ultimately a more refined way of doing that, okay? Find out what they know, ask permission to share more information to help them if they're interested, and then elicit what they got back, okay? It's very important to be aware that you're not sharing that advice, right? How many of you have been sitting there and people just start telling you what your thoughts are, right? You didn't ask, nobody asked, but they just start giving it. It was my best friend. This morning we were talking, she goes, oh, I need to exercise more. I'd really like to get more muscle mass. And I caught myself, oh, you know, have you? It just was automatic. But I say, would I be able to give you a little information? Would you be interested in that? And she's a smart aleck, so of course I got, well, duh, yes, yeah, tell me. So, but just something to think about. And again, if they come up with their own reasons for change, they're more likely to do them. Okay? We've got the education, and we've got all these fantastic ideas to help, but ultimately you want your patients to be coming up with their own ideas. Okay? So, factors influencing health status. So I'm zeroing in on healthcare, but this, I just really like this infographic because what this is saying is that 55%, and you could probably even add in some of the environmental factors, factors influencing health status, only 10% come from healthcare itself. 40% is from behavior and lifestyle, okay? 15 is social, which can be adjusted, and so can probably environmental factors. So my hope is that people feel very excited about this and realize we really have an opportunity to have an impact on outcomes for our patients, for our clients, for our athletes. We have this opportunity because the majority of these things can be adjusted through a healthy, positive, supportive therapeutic relationship. Okay? I wanted to close with this again, hoping, that you might feel a little excited and interested, but just to kind of give you a picture of what MI is looking like. Okay, so we've got the spirit we talked about. We talked about empathy, so I zeroed in on a couple of the principles to work in. The skills you'd really learn about in a training. And again, but what this is showing you is if you get these pieces in, we're hopefully getting to behavior change, which again, we're hoping for positive outcomes. But don't forget, you don't have to have this perfect. Incorporating the spirit can have positive results all by itself. Okay? So if you're interested, I thought I'd just kind of put together things that you might want to be thinking about as you're sitting in a session. So you've got a patient that's not quite ready for change. Okay? They might be tossing it around, but they're just not quite ready yet. So what you're going to want to do, the goal is to help raise awareness, right? Maybe develop some discrepancy on their current behavior and where they say they want to go. Informing and encouraging, so working in the elicit, provide, elicit, okay? Seeing what they know, offering them more information, helping to build their self-efficacy and their confidence and their ability to do it. They're unsure about change, right? So they're ambivalent, that stuckness. Ambivalence used to be called denial, so if that might help put it into a different context. So the goal is, again, build the importance and the confidence. Why do they want to make that change, and can they make that change to help them get ready for that? And then they're ready, and this is what we want. We want our patients ready and excited to go. Helping, again, making sure they're involved in the goal setting, right? They're coming up with their own reasons for change so that they're more likely to stick with it, and getting a plan in place, okay? Does that flow feel okay? Again, just to kind of be thinking about if you're sitting with a client. This is a Shel Silverstein quote, and I love Shel Silverstein. So I'll read it. There is a voice inside of you that whispers all day long, I feel that this is right for me. I know that this is wrong. No teacher, preacher, parent, friend, or wise man can decide what's right for you. Just listen to the voice that speaks inside. That's what we want to do for our patients. We want to encourage and hone in on listening to what is inside them. They know what they want to do. They're going to do what they want to do anyway. How can we help them when they're stuck, when they're ambivalent, and kind of move through that a little bit? So ultimately what MI is going to be able to do is it's going to shine a light on how we're approaching and looking at behavior change, okay? Listening for that change talk. Learning MI involves skill development. We can't do it in an hour. So if you're interested in trainings, a 2 to 3 day training, which I do, do motivational interviewing well, and your outcomes are going to be better. The evidence, the research is out there to support that. It may take more time at first. When I started learning MI, I was exhausted. Dietitians tend to want to know everything yesterday. And so, you know, walking through that framework I just showed you, making sure, trying to literally check off what they're doing, because we want to help. It's just in our nature. But give yourself that time, go to trainings, get coaching, and ultimately it's going to make your sessions more effective. Okay? So if it feels like a good fit for you, some suggestions to kind of get started. So bring the spirit in, support their autonomy, build that partnership, use a lot of we language. You know, how can we figure this out? Compassion, again, so important. Evoking their own reasons for change. Empathy is key, okay? Put yourself in their shoes, make a guess as to what they're feeling. They'll correct you if you're wrong. Asking permission, so not assuming that they want to hear it. Practice the elicit, and remember ambivalence is normal. It's completely okay. Okay? So I put up some books so that you could have them on your handouts. The motivationalinterviewing.org is our Mint group. So I'm a member of the Motivational Interviewing Network of Trainers. I neglected to say that. So you actually apply, you get accepted. So the people in this group know their MI. So you've got that, another great resource. And feel free to keep in touch. So I second what Carrie said, you know, email me, let me know, call, I put my number up. It takes time and you want to have a support network in place. So that's what I have for you. Any questions?
If you have a question, we set it up so you could come up to the mic. I hope that's not a deterrent. Come on up to the mic, Carrie.
Okay, I recognize this question goes against your entire talk,
Yes.
but just curious.
Yes.
You are talking about how this is a more gentle approach, empathetic approach. Are there any circumstances or types of clients you would ever need a more direct, harsh approach for that you wouldn't recommend using this type of technique?
So that's a really good question. So the question is there any kind of situation that you would need to be much more direct and not necessarily kind of taking the time to work through whatever it is? MI doesn't work in every situation. So there are going to be situations where you might need to be more direct if somebody's health is in dire straits. So MI, I think maybe to answer your question better, MI is really well utilized when people are ambivalent about change. If there's a more urgent medical condition, I think that the team will probably be in place to kind of direct that a little bit more. No matter what, they're still going to need empathy and compassion and reflecting back and understanding that turmoil that they're in. But you're right, it's very hard for me to kind of get into that, you know, yes, you have to do this. I guess the other part too, especially with regards to nutrition, is that they're already getting blasted with their BMI and all of their health, you know, adversities and all the things they need to be doing, that I just didn't want that in my session, to maybe help them work through the other negative pieces that they're having to get them through to the other side. Does that answer your question? Okay. Anything else?
Thank you, Angelina.
Thank
That
you.
was
Thank you.
awesome. I know for me, working for decades with low-income families, probably the most important thing was not to be judgmental.
Exactly.
And to be
Yeah.
open and empathize with where they were coming from.
Exactly.
So
Yep.
that was so good.
Good.
So good.
Thank you. Thank you.
Thank you. And there'll be lots more information in her breakout session.